Toxins, all the neurotoxins have gone through extensive studies with the FDA, and they do have FDA approval. We also use the toxins in very small amounts compared to, you know, what they could be used for other treatments, other modalities. Safety is always our first priority whenever we're treating patients. So absolutely, yes, they're safe. They have undergone extensive testing. No, toxins are absolutely not just for women. They are for women and men. Anyone who has a line or a wrinkle that they do not want, do not like, we can use the toxins to safely minimize and soften those lines. So you can certainly use toxins to help when we already notice signs of aging. So if you come in, you have deep lines, deep wrinkles somewhere, we can certainly use toxins in those areas to soften the lines that we see there. But you can also use them in areas to help prevent lines from occurring. So that would be somewhere where you have a lot of animation in a certain muscle, and we see that line form when you animate the muscle. But maybe when you're at rest, that line is not so prominent, or maybe not even there at all. So you can use the toxins in different dosages to achieve different results. Toxins are not permanent. It is only going to last you roughly 3 to 4 months if you treat to correction. So with toxins, a good thing to kind of keep in mind is dose does dictate duration of the product. So if you treat a muscle with whatever the provider that you see recommends, it typically will last 3 to 4 months. However, with that being said, you can also treat light in an area if there is an area that you prefer to have a little bit more movement in. Just know that that product won't last, you know, the full 3 to 4 months. There also is, there are certain muscle groups where you have to treat light. So if we're treating anywhere around the mouth with the toxins, you have to do a light dose in that area. And due to having a light dose in a movable muscle, that product will only last you maybe 1 to 2 months, give or take. Something to keep in mind is that results do vary with each person. So each individual is going to metabolize and utilize the products differently. So some people could get a longer duration than others, and that could be the same for different products as well. So when the neurotoxins are injected, they are injected with little needles. Our faces are very, very vascular, and so there always is a risk whenever we're puncturing the skin of swelling and bruising in the area. Typically, it is just a smaller bruise that can be covered easily with makeup, but there always is a risk when a needle punctures the skin of having bruising.